Yeah, so the randomized study of ASTX727, otherwise known as oral decitabine cedazuridine, with or without the LSD1 inhibitor Iadademstat, is a study that I'm leading in conjunction with the NCI CTEP program with collaboration from Horizon Genomics. So to set some background, patients with accelerated and blast phase MPNs have quite poor outcomes with AML-based therapies. So our group has previously looked at a 200 patient cohort that was treated in the modern era of AML therapies with accelerated and blast phase MPNs. And what we found was an overall survival of less than a year, and similarly poor survival whether patients received intensive chemo, DNA methyltransferase inhibitor plus venetoclax-based therapies, or other DNA methyltransferase inhibitor therapies. So kind of with that in mind, and really the need to identify novel strategic approaches for this patient population, we ultimately set out to design a randomized study looking at the efficacy of the LSD1 inhibitor, Iadademstat, in the space. So LSD1 is fairly ubiquitously overexpressed in MPNs, and there are data to support the combination of Iadademstat with DNA methyltransferase inhibition in the de novo AML population. So with that in mind, what we have done is we've designed a randomized study looking at oral decitabine cedazuridine plus or minus Iadademstat in patients with accelerated and blast phase MPNs that are treatment naive. So this study is in the midst of a dose escalation phase right now. So we will identify the recommended phase 2 dose of Iadademstat in combination with ASTX727. We expect to enroll 9 to 12 patients at the dose escalation phase. Once our recommended phase 2 dose is defined, we will be moving to a randomized study. So it will be 25 patients treated with ASTX727 monotherapy versus 25 patients treated with the combination of ASTX727 and Iadademstat. The primary endpoint we'll be looking at is rates of acute leukemia response complete within 4 cycles of therapy. So we're using a response criteria that's specifically been developed for accelerated and blast phase MPNs. Secondary endpoints, we'll be looking at response based on more traditional AML criteria, rates of allogeneic transplant, overall survival, and event-free survival in our patient population.